My name is Sierra Bragan, and I'm the owner and founder of Miami Mom Collective, and we are Miami's premier parenting resource and community. Our goal, our heart is to create resources that are helpful for moms, for families, for children. And so we have been partnering with UHealth Jackson Children's Care for goodness, 2 years now. I think we're going on maybe 2.5 years with these amazing webinars. And it is just a personal joy to know that we are bringing you the best of the best information and an opportunity to get to candidly ask your questions to an expert. I think as a parent, to me, that is so valuable on all these different topics that maybe in other settings, I might be kind of intimidated to ask my questions, but here tonight, you're in a safe space and you're welcome to ask those questions. So just thank you for joining us. If we can serve you at Miami Mom Collective, find us on Instagram, miamimomcollective.com. We are here to serve you. And I want to tell you a little bit about UHealth Jackson Children's Care. So you may or may not know, but the pediatric emergency rooms at Holtz Children and Jackson North and Jackson West are available 24/7. They're all staffed with board certified pediatric emergency medicine specialists. So kids and parents get access to every pediatric subspecialist at Holtz Children's Hospital from the University of Miami Health System and also from the Jackson Health System. So a great thing to note is that the Holtz Children's Hospital offers a 24-hour kids-only emergency room. So, nobody wants to go to the emergency room, but if you have to take your child, you want to take them somewhere where they're not exposed to everything. And so that's a great place for you. And then also, all the doctors and the nurses there are certified in pediatric advanced life support. So great resources there for you. Also, this is something new that we're excited to share, but UHealth Jackson Children's Care Urgent Centers have partnered with UMNSU CARD, which is a Center for Autism and Related Disabilities, and they have created autism-friendly designation, which is the very first in Florida. So this means that staff at all 5 urgent care centers have been specifically trained and that all the centers have specifically designed and designated sensory-friendly exam rooms. So patients are getting exactly what they need in the most loving and intentional and cared for way. I just think that is something so huge. I'm so proud of Jackson for that. So way to go. If you or someone you know has a child that would benefit from that, just make a mental note. So if you ever need an urgent care, all 5 centers with Jackson have this. So great news. Well, I know I'm talking a lot on the front end, but I'm going to get quiet here in a minute. And you're going to hear from our expert. I'm excited to introduce you to Dr. Natasha Poulopoulos. She is an attending pediatric psychologist with the Pediatric Behavioral Medicine Service at Holtz Children. So she provides consultation services. She treats presenting conditions, including anxiety, depression, adjusting to illness, medication non-adherence, and end-of-life care. So she's really dealing and working through these very hard things, these really hard topics. And so she's here tonight to share with us. She's also a member of the Society of Pediatric Psychology, and she's co-authored several peer-reviewed publications and presentations focusing on pediatric populations. And she's also an advocate for sexual and gender diversity, and she wants to create a safe and inclusive community for everyone. So we're so glad that you're here, Dr. Poulopoulos. Thank you for joining us.
Yeah, I'm excited to be back since our last conversation. I've been really looking forward to this.
That's right. So everyone, visit jacksonevents.org and you go back. So Dr. Poulopoulos was with us. And I remember there were guests that were like, we need more of her. And we said, hold on, March 31st, it's coming. So you get your own entire episode tonight. And we're so excited because we know you have a lot to share. So let's jump right in. And I want to begin with, again, we've all survived a pandemic. It's affected all of us. It's easy to forget how it's probably affected our children because we just think they're resilient, they're unaware. But talk to us about what is the current state of youth mental health in the US.
Yeah, I love the way you prefaced it. Kids are extremely aware at most ages, but sometimes they need help receiving information. So what happened back in October of 2021 is the major entities, so the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association declared a national state of emergency in children's mental health. So I think there's been a lot of emphasis on COVID playing a role, which it certainly has increased distress. One thing I like to somewhat debunk is that this was happening way before the pandemic. Since 2010, over the past 10 to 12 years, children's mental health has really been deteriorating,
Well,
and it's just been plummeting. So I think
well,
COVID kind of unmasked something that was already brewing, in a system that was overloaded, and that really shined light on what was going on in children's mental health.
mhm,
Um, we know that suicide is the second leading cause for individuals ages 10 to 24. One
mhm,
thing I will say is that during the 2 years of the pandemic, there has not been data that has shown that youth suicide has significantly increased compared to previous trends. However, it is still the second leading cause. So, like I mentioned, this was a problem prior to, and
mhm,
adding a perpetuating factor certainly doesn't help. Another big point I would mention is that overall adolescent females really showed increased distress during the
mm,
pandemic. So, there was a rise in eating disorders among adolescent females, and
wow.
bizarrely enough, tic disorders, which is a little atypical. But we can talk about factors contributing to all those. But that's where things have been generally, and we can even get into more detail.
Yes, and we will, because I'm like, just like those few sentences, I'm like, okay, now I have 15 questions about all that. And starting with, the title of this webinar, a national emergency, and it came through my inbox too. I've been getting the promotional emails to remind me about the webinar. And I think, that's a sensational topic, like sensational headline. Let's get their attention. But like that's a reality. Like there literally was a state of emergency declared on the mental health of our youth. This is a serious, serious topic that I think a lot of people are just unaware. So it's so important. Talk to us more about what factors of the pandemic, maybe specifically, let's camp there and then go into the other things, but what factors of the pandemic may play a role in exacerbating the children's mental health crisis?
Yeah, I think unfortunately there's been blame on online schooling or lockdowns and school closures. There has not been data that has directly shown that those are reasons for increased distress and poor mental health. And like I said, this was prior to. We also know that school in general is a really stressful experience for most children. I think that in the US, kids are about 55% more likely to attempt suicide on a school day rather than a non-school day. So that just that shows the level of stress at school. And we can talk about a different episode about like what maybe schools can be doing, but again, they're also overworked. So I think the factor is that changing a kid's regimen and their structure is
Mhm.
what was causing distress, right? So like going from
Mm.
in-person school to then online to then a hybrid to then in person, it's that like constant change, which
Mhm.
even as adults we know can be really challenging for most of us when we feel
Sure.
comfortable in a routine. I think that was really tough. Another really big thing to highlight is, and I keep seeing the data uptick. A few weeks ago, it was about 140,000 children in the US lost a parent or caregiver due to COVID. I think it's gone up to about 200,000. So that's like a huge component of grief for kids. And again, it's also disrupting what their experience is. It's disrupting their daily life. So
Mhm.
those are factors within the pandemic that may be playing a role. But again, this was also prior to. So I think it's important to think of what was stressful for kids before the pandemic, because that's certainly still going to be there when the pandemic ends, hopefully in the future.
Right, right. I've got to think too, just as an adult myself, I have little people, so I know it kind of affects them in different ways, but I'm like, I'm more stressed out than I was pre-pandemic. And so I'm sure that's affected my parenting, my interpersonal relationships with my children and extended family and that kind of thing. I've got to think some of that has to be, an opportunity to play a role as well. Just if all of us are a little bit at capacity. Um, I like what you said about school. Let's talk about a topic that is not, of course, limited to school, but I think sometimes we kind of associate it in that context. But how do we talk to our child about bullying? And I've got to think that's a factor. And how do we teach them the skills to minimize the effects? Like, are there any resources that you would suggest or tips?
Mhm. Yeah, and yes, bullying is a huge factor at school. I think for particularly socially anxious kids or kids that were experiencing a lot of bullying at school, online school is actually kind of something they thrived in. So In terms of bullying, we always talk about when you talk to a child, you have to think of their developmental stage, their age, right? Like when we talk to 5-year-old as opposed to a 15-year-old. I think in general, if we're talking about younger children, using really simple language to just explain like step one, like what is a bully?
Mhm,
So some language can be like a bully is a person or it's someone who purposely tries to hurt other people.
mhm.
And then see if if your child is understanding that, or if we have to like go even like a step down. And then from there, just talking about like, well, what does that mean? It means that they can be hurtful verbally with their words, they can be physically hurtful. And, unfortunately, we see a lot of cyberbullying. So it's more that social component. And I know that, again, like adolescent females are often targeted by cyberbullying. So step one is explaining what is a bully to a kid so they can understand and be aware and look out for it.
Mhm.
Um, and then having open open-ended conversations with kids. So I think the next step is like if you discover that your kid is being bullied, ensuring that you're listening to them and validating their experience really
Mhm.
would stick away from things like, oh, just like let it go or suck it up, because no child deserves to be bullied. And we
Yeah.
definitely don't want to pretend like that's normal because it's not. So having that conversation, ensuring that your kid feels safe talking to you, validating their experience, and then parents then need to take next steps. So
Right.
contacting school personnel, asking your child if there's someone at school who's like a trusted adult they can go to and let them know what's been going on. And big thing is reminding your kid that it is not their fault that they are being bullied and that no one deserves to be treated that way. Because I think kids will start to internalize that it's something about them.
Mm.
When, a lot of research has shown that it's often something that the bully is experiencing. So they feel the need to like have control, or maybe something more about their lower self esteem.
Right.
And then the big thing is that parents really are the ones then stepping up and adult to adult having a conversation with the school about how do we resolve this, especially because most schools I think have like a zero tolerance
Yeah.
policy when it comes to bullying.
Right. Yeah.
Yeah.
That's good. Didn't mean to interrupt you.
Oh, I was
Sorry,
just going
go
to
ahead.
say, I
That's
think
good.
like this is, I often feel like sometimes I talk about the ideals and then there's also like the reality of like that may well not take away the bullying in the moment or for a few weeks or until there's intervention. So, other than having your kid talk to a trusted adult at school, just having them like just helping them with like grounding themselves and calmly walking away and
Mhm.
ignoring in a way that you're explaining to them like we're ignoring in this moment because we don't want to join them in what they're doing because what they're doing is harmful, and then encouraging that kids stick up for each other. Like I can't emphasize that enough, how important it is to have someone on your team. So I also think when you talk about bullying with your kids, talk about if you see someone being bullied, this is a way that you can step up and you can stick up for the person in your class, or you can stick up for your friend, or even just the kid that you've never spoken to. It's an opportunity to make a
Yeah.
new friend and stick up for them.
That's good. Oh, such a good reminder to equip our kids to do that. Give them the language, give them the scripting, the words, the confidence to do that. We received a question from our audience that I think is along the lines of this, maybe a more specific instance. You could kind of coach us through this, but this attendee says that their 14-year-old insists on wearing her mask, not because of COVID, but because the kids at school are accusing people of mask fishing. This is a term I'm unaware of, but I think a runoff of catfishing is what they say. So how the parent is asking, how do we address this with her school? Like it sounds a little like a form of bullying. Can you talk, kind of guide this mom or dad of how to address this with the school?
So their teenager is being bullied because they're wearing the mask at school.
Uh-huh. Yeah, I think that maybe there's like a trend going that they're accusing you of, are you wearing a mask because you need it or you don't need it? And so everyone's just like, wear the mask.
Okay. Yeah, unfortunately, like we live in a society that masks have been politicized, which is extremely unfortunate because we know that they help save lives.
Right.
I think that talking with it's so one, like I validate this parent's experience. That's a tough situation. Um, I would talk to school personnel about like what is the policy around masking and what have other students been having this experience, and see like how the school wants to proceed with addressing this. I think in terms of talking to your kid is like it, that's why I say like having that open communication with your child about like, like how does that feel when that happens for you? Yeah, I imagine it's like really annoying and frustrating. Do you know if there's other people in your class that also wear masks? And maybe you can all together be like, listen, we choose to wear masks. Like, what kind of making, it's almost like when you stick up to a bully, sometimes they deflate because it's a little of a facade. So
Yeah, they're not
it's like,
expecting it.
exactly. So just like almost questioning the bully, like, why do you care if I wear a mask?
Yeah, yeah, yeah. That's good.
But again, like talking with the school, because I'd be curious, like if that's going on for other people too.
Right, right. And maybe not just a one-off situation. There might be others who are struggling, wrestling through that. So that's great. So bravo to parents advocating for your kids. Love that. I think that's our call and our duty to get to do that for our kids. So another question on this topic, Matt with Sky Schools is asking, what are the tools to walk away or upstand for each other? He said that they use a lot of breathing techniques, but what do you recommend for kids in the moment to develop that moral courage to stand up to the bully? Any techniques there you would suggest?
Yeah, I think with most things in life is like when we have a script and we have the language ready, we don't have to think as much in the moment, like we've practiced. So
Yeah.
again, it like depends what grade your kid is in, but helping them develop the language that they feel comfortable in that moment to be empowered to say, like, even just if one, they can choose to ignore and walk away. And if that resolves it, great. And I think in that moment, we can also skip forward where I'm going to talk about some like grounding and calming techniques for kids,
Yeah.
such as like really like diaphragmatic breathing, or like we call it progressive muscle relaxation. Big word, fancy word for something super simple, is like when we, like, for example, clench our fists and hold it for a few seconds and then we release, is like we're inducing the physiological tightness and the tension. And then after that, the relaxation response comes on. So sometimes in a situation where you maybe not want to show the like deep breathing that you're doing, that can be helpful. And you can do it throughout your body, not just your fists. It can be your feet, like pushing them into the ground and then releasing. So those can be like grounding techniques in the moment, because it's understandable a kid is having an internal experience to bullying.
Yeah.
And then if the grounding techniques and the walking away suffice, great. If it's even taking it a step further, it can be like practicing a script to say to the bully, like, okay, it doesn't really bother me when you say that, so I'm not really
Yeah.
sure what you're saying it. Like, again, the
Right.
sticking up to a bully. And I really defer to schools. If they have scripts, I love that. I think most schools probably have something in their policies. And another, like you mentioned, groups online, like stopbullying.org is a big organization.
Okay.
They have a lot of tips for parents on there too.
Great. Awesome. Stopbullying.org. That's great. I love the grounding things. I've never heard that specific, terminology in this context. I think that's great. It makes you realize just how like our fight or flight pops in, and that physiological thing takes over. And we've got to learn how to, even as adults, we're still learning that, how to deal with that and equip that. So to be able to equip our kids is awesome. Okay. Question. This is from another mom, a little bit we're going to transition to a different topic, but we can circle back at any time if more questions arise. But what should parents of small children do if they're now like more shy than usual, having like a little more social anxiety, maybe given to the circumstances of the last couple of years?
Mhm. So I mean, so we can talk about tips that is before going into like maybe taking your child to see a therapist, which is a very normal thing to do. And it can
Mhm.
be extremely helpful, just a few quick sessions. But I would try to like assess the level of your kids' anxiety and ask them questions like, what situations is it that you feel anxious in? And okay, well, we can actually practice, because we know when we expose ourselves to the thing that we feel anxious about, over time, it actually reduces our anxiety, right?
Mhm.
And conversely, when we continue to avoid the thing that makes us anxious, the anxiety continues to build. And then our response in the situation is 10 times more overwhelming.
Mhm.
So I think with kids, you could start, it's kind of like exposure therapy, right? So first assess, like with your child, what is it that makes them feel anxious in a social situation? Like literally breaking it down, like, do you feel comfortable? Can we start with having like a one-on-one play date?
Yeah.
And if you can tolerate that for 30 minutes to an hour, great. Then maybe the next time we can add another friend. And it's just like gradual increase in the exposure of a social situation, that then the child starts to develop a self of confidence at that lower level of anxiety. And then that level of like mastery and confidence, then they feel like it starts building as they go up. And again, I say that confidently, but it's very normal for kids to have setbacks. Like no process is like this. It's often like this.
Right.
But the important part is like assessing with your child, like, okay, well, what are things we could try?
Yeah.
And then I think for some children that are more socially anxious is maybe putting them in like an activity, because that reduces a little bit of the one-to-one pressure too. Like they
Mhm.
want to do like a specific sport or theater or a club. That's like a good time where kids can find interest they have with other kids. And then the moment a kid connects with another kid, like it's amazing, right? They start to share
Yeah.
interests, they start to feel more confident. So it's really important to find ways to socialize them that it can be also group, so it takes the pressure off of the one-to-one.
That's good. So maybe even I'm thinking I have little people, maybe this mom has little people. If school maybe is the challenging place and obviously like, okay, you gotta go to school, but maybe arranging some play dates with a kid or two from the class and try to create a space where they can make that connection with another kid in class that would give them kind of that excitement to going to school. Would that be a helpful strategy, I guess?
Yeah, and even like, kids are so awesome, right? Like we talk them in ways that like they really want to understand their world. So you can even practice with your kid. Okay, well, let's practice. Like if you were to meet a new person that you wanted to talk to, like what do you think are things that you could start a conversation, right? Like,
Mhm.
oh, I really like I'm being very strict. I really like dinosaurs. Like, do you
Yeah.
like dinosaurs? What would your favorite be? Oh, you don't like them? Okay. Well, what do you like? Right. So practicing scripts with
That's good.
kids, because
Yeah.
that again, it's like exposure in the moment with a parent that then they can practice in the moment and they don't have to like think as much.
That's great. That's great. I am all for scripts with the kids. I use scripts myself when I'm disciplining the kids because I think it's so easy to just get off the path, but it's so helpful when you have that predetermined little tip and helpful with you. So great. On the note of coping strategies and tools, let's talk about, we received a question from a listener. How do we teach our kids when they get anxious or panicky at school? And this family particularly, they live very close to the Parkland shooting. And sadly, just with the other shootings that have been happening around town, like heartbreakingly, some kids are anxious. They're anxious about going to school, rightly so. I mean, it's so sad.
Yeah.
It's a different world that we live in, our kids are living in. But what tools or coping strategies can we teach our kids if they get anxious or panicky at school? You've touched on it a little bit, but let's go a little
Yeah.
deeper.
And I'll be honest, because I'm not going to claim that there's like a solution to everything. Some of it is like our human experience, and it is normal to feel increased anxiety in situations that are anxiety provoking. And I wish I could say that you could tell a kid, well, that's never going to happen. But the reality is, like, we live in an unpredictable world. So it's like, how do we start to tolerate the distress of uncertainty? So, what I would say for kids is like, diaphragmatic breathing. I really harp on it because truly, so like I'm going to get into my little anxiety pitch here, right? So like our mind and body are constantly connected, they are always working, they're synchronized, right? So you notice, if you like use the word panicky, some people start to like see that their breathing gets more shallow, and they start to feel like palpitations, or they feel like an elephant is sitting on their chest, their palms get sweaty. That's a physiological response to anxiety, right? Where
Mhm.
anxiety is
Mhm.
it's the cognitive piece and the body piece, right? And we know
Right.
majority of younger children, they tend to experience anxiety in their body, right? Abdominal pain, headache. So I would say that deep breathing is right. So you can, and there's a lot of tricks online. There's stuff like box breathing, like using a stuffed animal on a child's belly. So like when I say diaphragmatic breathing, it's truly like I'll say like, show me how you breathe. Most
Yeah.
people actually don't diaphragmatically breathe correctly. Right. So you go in through the nose, and as you're breathing in, the belly should be rising because the
Mhm.
belly is filling with air. And the chest should remain still. And then you hold it for 3 seconds, and then you open the mouth, and then you push the air out for 3 seconds. And then when that's happening, the belly should be going back in.
Mhm.
Truly, even as adults, I do this all the time when I feel anxious. It sends a signal with the mind and the body that's working to regulate your breathing, and then the mind is like, oh, okay, so my body is pretty calm, so the mind is calm,
Okay.
so it's sending this like feedback loop.
Right.
So regulating physiological responses like breathing.
Mhm.
Other things are like mindfulness is a huge topic that's been, really researched, and it's been like a big third wave of treatment in psychology. So quick tricks I teach for mindfulness is like the 5 4 3 2 1 method. So
Okay.
mindfulness is bringing your attention and awareness into the present moment. So the 5 4 3 2 1 is like Name 5 things you can see, 4 things you can feel or touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste.
Okay.
Yeah.
That's good. Working, I
And
mean, that just will help you just come right here in the moment.
yeah, and I mean, I'll get even, and these are maybe, I think it's for all ages, but then if we're also thinking with teens, the reality is like it's understandable there's anxiety, particularly related to incidents like school shootings. So I would say in that is like, somewhat this like radical acceptance of like I can only control what I can control in the moment. And there is a plan at school in place if something unfortunate like this were to ever happen. Because it's true that we can't control everything, but we can control ourselves in the moment and our body, which then sends signals with our mind.
Yeah, man. Oh, yeah, that's tough. This is so good. So many great helpful tools and strategies and resources. I do want to transition now to just the seriousness of the topic at hand. What do we need to look for when it comes to self-harming behaviors in our children? What are things that we should be aware of and be looking for?
Yeah. So I will preface that, like, if your child is self-harming, I would absolutely get them in psychotherapy and in treatment right away, to have that addressed and treated.
And I'm
Um,
sorry to interrupt you, just because this is so important. You know, I hear you saying that. Speak specifically, like you should call a psychologist, you should call a psychiatrist, like equip these families with this is the call you need to make to this type of doctor, I guess, to get that help.
yeah. So yeah, and I hate to like give long responses, so I'll try to be
No,
brief.
no, it's
But
great.
I'm glad that parents are asking these questions. Like honestly, to every parent out there, thank you for talking about youth suicidality because it is truly something that's prevalent and it's real, and there is no harm in talking about it.
Yeah.
Suicide can be prevented, particularly by talking about it and finding out like where kids are at in terms of how they're feeling. There's a huge myth that talking about suicide increases someone's suicidality or induces it. It does not. Talking
Mhm.
about suicide is safe. It will not make someone suicidal. And I think that all parents should be talking with their kids at a developmentally appropriate level
Right.
about what's going on in the world and what they may be experiencing. So within that, if a child is self-harming, I can talk a little bit about like what that may look like. So in our field, we often refer to it as, which I think will help elucidate what I'm talking about, like non-suicidal self-injury. So, and I'll explain what it means by non-suicidal. So the most common method tends to be cutting, which is like, unfortunately, it's been like kind of glorified and shown in a lot of television shows, but it'll often be cutting. Some kids can also like burn parts of their
Mhm.
body, or they may just like pick at skin excessively or at wounds, kind of like a self-mutilating.
Mhm.
And when I say like non-suicidal self-injury, self-harm may look like suicidal behavior. However, it often is not. So kids will often self-harm because it can be like an emotional release.
Like soothing in a way for them of
Yeah, so
what's
I call it
feeling internally.
I call it a maladaptive coping strategy, right? Because it's inducing harm. And that's, there are healthier ways to respond to their distress.
Right.
But for some kids, like they want to feel something other than numbness because their emotional distress is so overwhelming.
Mm.
It's kind of like a release from that pain. So that may be why kids may be harming. And then signs like to physically look out for parents is like suspicious looking scars on your child, or like wounds that are just not
Mm.
healing after like a prolonged period of time. And I know we live in Miami, so yeah, the weather's been a little temperamental, but if a child or a teen is like wearing sleeves or like long clothes in a situation that like really doesn't call for it, is there
Yeah.
potentially like scars that they may be covering up?
Yeah, that's good to be aware of. And I like that you went deeper into that because it can the first thought you think is like self-harm, you think of just suicide, but there's so many other things, like you said, that would be other yeah, just adverse ways to cope. Is there a way that we can screen our homes to implement like suicide precautions or to help prevent?
Yeah, and I know this was your original question that I unfortunately didn't answer. So I know there's parents
No,
out there
no,
who
no.
ask this. But so if you are concerned and if you're observing that your child is self-harming, if they're an imminent risk to themselves, like you are fearing that they're doing something that can truly take their life, you either need to call 911, or if you feel comfortable transporting them, to a local emergency department or mental health crisis center. Like Jackson Behavioral Health is a specific mental health hospital that has a crisis center, so they can be thoroughly evaluated to see like what next steps are needed to keep your kids safe.
Yeah.
If it's like a self-harm in like the more recent past, or a child is disclosed to you like, hey, I kind of thought about doing this, then you need to ask your kid, like, are you having thoughts about wanting to kill yourself? Right? You can kind of almost screen, in a sense, your child. I'm not saying that's what takes the position of a mental health professional, but just to know if something is imminent, meaning like it's immediate, like it's an emergency situation. If it is not, calling a psychologist or a psychiatrist to schedule an appointment as soon as possible so they can have an evaluation with your child and then treat your child, right? Like, it is a crisis, and it's overwhelming for a lot of parents. And we have treatments for depression, for anxiety, for trauma, and for suicidality and self-harming behaviors that have shown to be immensely helpful and effective.
Yeah. Wow. Thank you for.
Yeah. And I can now answer second question about
screening your home. Yep.
Yeah. And I say that because, right, if you're at the point where you need to like screen your home, your child like really needs to be in seeing a mental health specialist, or a psychologist, a psychiatrist, a therapist, or a counselor. So I would take the lead from your child's mental health team, right? I don't want to like take that away from anyone. I'm not treating the child specifically, and everything is child specific, like the situation they're in, the specific child. However, in general, guidance that I'll give is removing weapons from the home, keeping alcohol and medication safely secured or locked up and out of the child's reach.
Yeah.
And if there's concerns that your child or teen is in imminent danger, not leaving them alone. And like I said, getting help right away in emergency situation, calling 911. If you feel like you can transport them to the local ED or crisis center to be evaluated, then that would be the next step.
Yeah.
There's also in Miami, it's called the Children's Mobile Crisis Response. It's a number that parents can also call, and they will come to your home and do an evaluation.
Wow. Okay. Children's Mobile Crisis. Is that what you said?
Yeah, Children's Mobile Crisis Response. And the number is 305 424 3065.
Great. Will you say that number one more time?
Of course, yeah. So it's the Children's Mobile Crisis Response, 305 424 3065.
Awesome. Thank you. I had no idea. I've never heard of that. That's a great resource to know about. So I hope your parents jotted that number down. Again, tonight is being recorded, so you can go back to reference it. You can visit jacksonevents.org in the future to pass it on to a friend or someone that you care about to share with. And you'll also get an email to your inbox when it is live. So give us just, a week or so to get it all edited and up there, and then you'll have access to that. So Dr. Poulopoulos, let's talk about, given the war in Ukraine, I have to say we had the news on, a week or so ago, and something popped up, and it was like these very graphic images, and my little people were running through the living room, and it occurred to me, oh goodness, this is really graphic, but our kids are not hidden to this, but given the current war in the Ukraine, how do we talk about this with our children?
Yeah, I'm also just thinking, like, to be a parent right now and a child, there's a lot of challenges. Like, we're shifting from talking about a pandemic to talking about mental health deteriorating over the past 10 years to now a war. So again, everything is like a developmental hierarchy about like where your child is at developmentally in order in thinking of how you're going to speak with them. So in terms of the war in Ukraine, first, it's like assessing what your child knows. So like kind of seeing what they're at, what is it that they're understanding about what's going on with the war, and then be prepared and be honest that, things are changing and you're going to do your best to answer their questions. It's okay for parents to admit things they do and do not know. Going back to the idea of the age of your child. So for younger kids, they tend to really like personalize information and what's going on in the world. So a lot of younger kids could be like, is this going to happen to me? Is this going to happen to my family? Is this extremely close to home? So ensuring them that they're physically safe right now and their parents are safe. Reassuring them of that, and then using like simple language about the true facts. Like if a kid says like, yeah, I heard there's a war and a lot of people are dying, you can be like, yeah, that's a really unfortunate thing that happens with war, is that people do pass away. Like, how do you feel like knowing that or hearing that? Allow your child the ability to express like what the facts mean for them
Right.
emotionally and internally, and sit with them in it, right? Like, most people, when they see that someone can tolerate distress with them, it's much
Mm.
more calming and it's much more validating. Um, and like you mentioned with like the news, like absolutely, like monitoring exposure to graphic images, we know that that can be like overwhelming for kids. I think sometimes kids want to feel empowered that they can help. So I know like all over like CBS 4 and Channel 7 that they have like scanning codes for ways that you can help people who are like going through the war, and like giving donations, or if there's somewhere local in your community. So it can be like, yeah, like this is really scary and it's happening. It's not happening like right here where we live, but we know that they need these supplies. So a way that we can help is that we can, donate these supplies, right? So kind of giving a in the moment somewhat solution after we validated and we understand like what a kid is understanding. I always say like it is always best to be honest with kids.
Yeah.
Do not lie to kids. That's the worst thing we can do.
Yeah.
Yeah.
Oh, that's so good. Yeah. And I want to be a source of truth for my kids. I don't want them to come to me and think, oh, mom doesn't know anything, because she doesn't tell me. I want to be able for them to develop that trust that they can come to me for anything. We can talk about it. So that's a good reminder. You spoke a little bit about this, but giving the concerns of increased screen time in kids during the pandemic, now the situation in Ukraine, like how can we best support our children or our teens with screen times? There's a lot of dangers there, but
Yeah.
talk to us how we can work through that.
Yeah, we live in an extremely digital world, understandably, which is like good, right? So it gives us
Mm.
access to a lot of things like this right now, right? Like we wouldn't be able to really do it. It
Yeah.
connects us with people all over the globe. And at the same time, there are a lot of traps with social media usage and teens, particularly. I think with in general monitoring screen time, so setting reasonable limits. So, like for example, I often focus on teens because I think that's when teens are handed a phone or a
Yeah.
device, or they're given like their own accounts. So like talking to your teen about like how to avoid like allowing like not having the phone next to their bed, right? And you can be the role model, but that's kind of hard for parents. But being like, yeah, you can check your phone, and then 30 minutes before bed when you do your routine and you brush your teeth or you shower, like your phone is going to be put in another room and you get it in the morning. Just like really neutrally stating that there are limits and being reasonable. I think for teens, like, right, we want to trust them and we want to respect their privacy. And I also think it's reasonable for parents to monitor teens' accounts from time to time, like letting them know, like, you're going to be checking their accounts. I think also, I don't want to, teens are very smart, right? There's things like Finsta, fake Instagrams, fake accounts, but do you have that relationship with your child where you can truly talk to them about why it's important? So like, there's a lot of stuff out there that's really hurtful to a lot of people, and I just want to keep you safe. And that's why we're having this conversation, like providing the rationale. And then it's like the same with bullying, like educating kids that like, if you see something harmful online, like let me or an adult know, and like, because this shouldn't be out there because it could affect another kid or a kid that doesn't feel safe talking to their parent.
Mhm.
And then like I said, like kind of being mindful of your own social media habits, because kids do what they see, for
Yeah,
being honest.
that's true.
um so I think doing that, and then like with the news, it's kind of similar with screens, like monitoring any graphic images with the news and stuff like that.
Yeah. No, that's great. Thank you for that. Yeah, so much is caught. And so much is taught, but a lot is caught too. So that's a good reminder about having good habits ourselves to model those for our kids. So you spoke a little bit earlier about grounding and squeezing hands and some of the breathing. Anything else? Any other techniques that you would remind us of about teaching our children to ground?
Hmm. I use those because they're kind of like quick mindfulness techniques.
Uh-huh. Will
I
you
also,
say the five things again? I'm sorry to interrupt you.
oh
I think
yeah,
that
I
goes,
love
I would
it.
love to hear that again.
Yeah, I use my hands usually. This is my prop, like the 5, 4, 3, 2, 1. Was that kind of fast? But it's like a fun way to like teach kids. But it's the idea of like mindfulness, bringing your awareness into the present moment, because that's what we can truly can control. We can't control the past or the future. And the 5, 4, 3, 2, 1 is 5 things you can see, 4 things you can feel or touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And if
Helps
you
me to remember the order. I'm like, okay, feel.
right, and right, like, let's say you can't smell something, like then you can just use your imagination and imagine like what would it be like to smell like a vanilla candle or like a
Yeah.
lavender spray, something like that.
Okay, that's good. No, that's so helpful. When we're talking about, I guess maybe broadly, but anxiety or depression or, just mental health in general, can you talk to us about signs that we should look for in, because I know we have some moms of younger children here, moms and dads, and we have moms and dads and caregivers of older children. So could you speak about kind of like, these are the signs to look for in younger kids. These are the kind of red flags to look for in older children.
Mhm. Yeah. And I'm like, again, I'm just like so glad we were having these conversations and parents are so invested in this because like, I'm so glad the stigma of mental health is being broken. Like, it's so great to talk to your kids, to your friends, to everyone in your community about like mental health does not mean mental health conditions. It means like mental health, like our emotional well being, our ability to talk about and process our experiences. So within that, like, yeah, you can look out for signs and always keeping open communication with your kid. So, for example, like for younger kiddos, if they're having increased distress, we might see it as like frequent tantrums. We can also see it as like really intense irritability. Um, we can see like they might start like talking about their fears or worries frequently, like it's being brought up a lot. I think sometimes for some kiddos, it could be like a bedtime anxiety or like fear of being away from a parent.
Okay.
Um, and then like I talked about this before is like thinking of like the mind body connection, like little kids often experience anxiety through like stomach aches. That's
Mhm.
like a really big one. Like, oh, I just like don't feel well. Or it could be headaches. And then if you see like a sudden academic change in your kid, right? Like suddenly they were like grades have completely dropped, or they're just
Yeah.
like, they're
Mm.
totally withdrawn in the things they used to like they don't, kids should not be bored. Kids should be like stimulated and enjoying something around them.
Yeah.
So if they're seeming like there's just nothing that stimulates them or brings them joy, like that's pretty
Totally red
concerning.
flag. Yeah.
Yeah.
That's really
And then when we think about like older children, we'll see like looking out for sudden changes in eating and sleeping patterns and behaviors,
right.
refraining from activities they once loved. So like this is a way I kind of say like you can ask yourself also like, is my teen engaged? Are they connected and are they functioning? Are they engaged, connected, and functioning? Right? If not, something may be going on. And it doesn't mean it's like a major depressive disorder. It doesn't mean it's a generalized anxiety disorder. It means that there's increased distress and it's a good time to talk about it and get treatment before it may worsen. Also, we could potentially see like with teens, there's like decreased just like energy, like more fatigue, being more isolated and withdrawn. We can also see the more externalizing, like the high risk behaviors
Mm-hmm.
and or what we talked about previously, like potential self-harming behaviors or like talking about like maybe things would be better if I wasn't here, which is to
Yeah.
some extent a
Yeah.
passive suicidal ideation.
Yeah. 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 Good. Thank you. All important things. And again, just commend all of our listeners tonight for being here to educate yourself on this important topic. There's so much we could just keep going. I'm watching our time. We got about, a little under 15 minutes. So if you've got a question, drop that in the Q&A box. We will do our best to cover it here with Dr. Poulopoulos. But we did receive one question from one of our viewers, specifically about, is there a pediatric psychiatric unit if your child is Baker acted? And I would say, let's stop. And can you talk about that? If your child needs help, do you always have to Baker act them? And can you speak about kind of what that is? Or can you bring them to a pediatric or adolescent mental health unit? Can you talk to us a little bit about that?
Yeah, so kind of depends on the situation, right? If your child has a mental health provider and they're experiencing like increased distress or like you're concerned of their safety, reach out to the provider immediately and they can help guide you like next steps. A Baker Act is, I don't want to get like too into it, but a Baker Act in the state of Florida is like an involuntary like admission to a psychiatric hospital or for an evaluation. So if like, example, I think that a kid is an imminent risk, right? Like they're having suicidal ideation, they have a potential plan and intent that they want to carry this out, then I would really be like, okay, like they need to be examined and they need to be evaluated. So that's like where a Baker Act comes in. It's the
Okay.
term of the involuntariness of it. However, with kids, like parents don't have to Baker Act their child. I would say, like, if you, again, like, if you're concerned about your child's imminent safety, you
Mhm.
can voluntarily like take your child to the ED
Yeah.
and they can be evaluated. And then that expert will say like, okay, like this is the level of risk. They'll go through like a full assessment. And then they'll give you recommendations about what next steps will be.
Yeah. That's great. Thank you. That's helpful. Just to know what's the best process there. Um, any more resources about how specifically we could find help for our children or teen? I know you spoke about, we put it in the chat here, the Children's Mobile Crisis Response. Thanks, Christina, for typing that number out for us. So any other great resources like that you recommend? Stopbullying.org, I think you said was another one.
Oh yeah, I have a lot of great resources. So infoaboutkids.org. It's great. There's like so many topics you can look up. It's like
Cool.
also with just like development.
Okay.
And then a lot of like, I know some parents have been asking about like therapy and treatment. So we've talked a lot about like distress and mental health. And then like, okay, now if there's a diagnosis or if my child needs therapy, what does that look like? Right. I think unfortunately we live in a society where therapy has been a little bit like, what does that mean? Or what are we doing?
Yeah.
But it's really open. Like it's no secret what we do. So effectivechildtherapy.org.
Okay.
Yeah, it talks about like what different therapies exist out there, right? So like with the one thing with psychology and with psychological therapy is like it's not a one size fits all. It's very specific to the person coming into the room who's being treated, like the child, and then seeing like what therapy is best, right? So for example, I'll just give an example for anxiety, often like CBT, cognitive behavioral therapy. It's often really helpful and effective in treating anxiety.
Okay.
And then if we think of more like high risk kiddos, so kiddos who are self-harming or they have like a chronic sort of depression and like suicidal ideation, things like DBT, dialectical behavioral therapy.
Wow, I've never
That's
even heard of it.
Oh, it's a great therapy. And I think you're going to
Okay.
have someone coming in a few months to talk about who specializes in
Great.
DBT. Yeah.
Great.
So there is a DBT program at Jackson Behavioral Health Hospital. I think there's a long wait list because it's so awesome,
Yeah.
but that helps like more high risk kiddos.
Okay.
So you kind of see that like they're kind of like, it's a big analogy, but there's like a medicine, like in medicine, there's a medicine for certain illnesses. Like there's a therapeutic modality to different mental health disorders.
Okay.
So effective therapy or effectivechildtherapy.org, it can talk about the different therapeutic treatments and modalities for different
Okay.
disorders.
Effectivechildtherapy.org. And we are going to put together, I saw in here, the team's going to work together to put together a tip sheet because there's just been so many great resources here, and it'd be great to have it in a one little PDF where we can see all the things. So stay tuned for that. We'll get that together along with the recordings. But super helpful. I saw a few questions floating in the chat, so I wanted to pull a couple of them out because we've got some time left. But talk to us, Dr. Poulopoulos. Someone asked, is there a book that you recommend for social skills for kids?
Oh, I feel like this person may have been reading my mind because my next resource
I
was
love it.
the American Psychological Association children's books. So it's apa.org
Okay.
/pubs/
Okay.
imagination.
Oh, look at this. Look what we got here for everyone.
Oh yeah.
Screenshot this, and then you've got great resources that you can reach out to. But okay, yeah, there it is. apa.org/pubs/imagination. Is that
Yeah.
what? Or okay,
Yeah.
great.
So the American Psychological Association is like the entity that psychologists belong to. And there are so many wonderful children's books. Like truly, if there is a topic a child is working through, like there is likely a children's book out there. And I like to go through the APA because it's kind of like now if you go to the grocery store and you look for milk, like there's so many different types of milk. There's
Right.
so many types of resources online. But the APA, like, you know, that's like a pretty credentialed book or a treatment if it's going through the APA and they're putting it on their website. So they're like awesome books for kids.
Wonderful. That is helpful. There's lots of great resources. I think a book is always so helpful too, because you can just, we read books about everything. So you just sit down, read a book. It's about what you're going through. It's great. Awesome. Dr. Poulopoulos, thank you so much. Clearly, this is not just a hot topic, an important topic, so much that we can keep going and keep going. And I think we will. We're going to have more future episodes going deeper on, some of these mental health topics. tonight. It was just so encouraging to speak candidly with you about this and our children. So thank you for being with us. Thank you to everyone who has listened in. I want to draw your attention to a couple things. We do these every 2 weeks. So go ahead and mark your calendar, because Thursday, April 14th, we are going to be back for another episode on developmental milestones, and it is going to be in Spanish. So I will probably not be hosting you for that one. You don't want me to host you in Spanish because you will not get quite the same quality, but we're going to have an amazing host. We're going to talk about crawling, rolling over, waving, forming sentences. What are all these developmental milestones? So share that information if you have a Spanish speaking friend in your life, or if that's your first heart language. We'd love for you to join us Thursday, April 14th at 8 p.m. So you're going to get expert insight into different types of developmental milestones. How are they interconnected? What are red flags, early intervention, all of that. And actually, this just in, it's not going to be in Spanish. I will be hosting it, and it will be in English. So I had a little typo here on my notes. So just know it's going to be in English. So join us. I'll be here. And I'm excited to go through that, because I am in the throes of milestones with our kids. We always are. And so it's good to know what things to be looking for. So again, Thursday, April 14th at 8 p.m., we'll be sending email reminders. So you'll get the RSVP for that. You can join us, but make plans to join us then. And again, as a reminder, all of our episodes, dozens of episodes, are available to you at jacksonevents.org. You can also sign up for, upcoming episodes, and this one will be there in just about a week, so you can share it with a friend. But thank you to those of you who joined us tonight. We're so grateful. One more quick question for you, Dr. Poulopoulos. Will you speak, just kind of tie a bow on it, maybe, with any resources that maybe are super applicable for children with special needs, with maybe autism, anything you would recommend for the parent who has a child, we're dealing with those things?
Oh, I don't specifically work with children with autism.
Okay.
But I'm happy I can, this is a great question, and I'm like kind of frustrated that I can't answer it. I can always, I don't know if this parent wants to share their email address with you, but I can always do a search and I can find resources.
Incredible. Great.
And I can send them to you, and you can send them to this person. I think in general, like going through the APA, the American Psychological Association, they should have like specifically a section for autism. And then also, where the other resources I shared, those also, like infoaboutkids.org, they'll also have a section that I think you can go by topic, or like presenting conditions. So you can look autism, and then they should have lists of resources there.
Awesome. Thank you. Yes, we will connect you so that y'all can coordinate in that way. Thank you. Thank you, everyone, for just your honest, candid, insightful questions and comments tonight. We really, our heart is to equip you to better serve your children and your family. And so a huge thank you to UHealth Jackson Children's Care. And please make plans to join us in 2 weeks on April 14th at 8 p.m. for developmental milestones. We hope to see you there. Dr. Poulopoulos, thank you again for your time, and hope everyone has a wonderful weekend. And if you haven't, take a minute, screenshot this resources page here. I think it'll be helpful for you. So thank you so much, everyone, for joining us. And I hope that you have a wonderful, wonderful weekend.